actually been 14 years now. And those of you who know me know that I came from a background in OBGYN, which I did for about 25 years. And honestly, got kind of burned out on the whole insurance company rules and regulations, some of which I still have to abide by, but decided that I really needed to do something different. And I actually even considered leaving medicine, but I have to be honest with you. I don't really know how to do anything else. And there really wasn't anything else I wanted to do. Like, I have a friend who is a dermatologist and she makes children's clothes, and, you know, she opened a shop and sells her children's clothes while she does dermatology. But, you know, some people are writers and physicians, and I'm really, I'm just a doctor, and that's all I've ever wanted to do and ever been interested in. So I had to figure out a way to do medicine and do it in a way that I'd be happier about, where I wasn't ruled by insurance companies, trying to put many people a day, you know, through my office, seeing people quickly and be able to really spend the time I wanted to spend with people. And so through a series of very fortunate events, I learned about functional and anti-aging medicine and started working with hormones. And one of my very earliest patients was somebody who was a physical trainer. And she came to see me for menopausal problems, fatigue, libido, mood. And she wrote a testimonial about, she was pleased with her results. And she said, it's been 2 months. I've been on the Sklar Center program and my energy is so much better. My muscle definition has improved and my burning tongue is not nearly as bad. And I was like, oh, what's that burning tongue? And, you know, what does that have to do with hormones? And so those of you who know me through the burning mouth, you know, kind of circuit, know that I'm very, very interested in burning mouth syndrome and treating people for it. And I kind of fell into it because of the work I did with hormones. And following that, which happened like 14 years ago, and treating burning mouth patients since then, I also got into the field of cognition and cognitive decline. And in the arena of cognitive decline is another area where hormones are really important. So I'm going to go through with you information about hormones and what happens to women through the life cycle with our hormones, what happens to men through their life cycles, and then talk about some of the controversies, because one of the biggest issues that keeps a lot of people from using hormones who really might benefit by them is the fact that they are afraid of hormones for one reason or another. And I want to address some of those fears and dispel some of the myths that surround hormone risks. So we're going to go through what changes through our life cycles and what the myths and controversies are. So let's talk about what hormones are. Hormones are great commanders in our bodies, and we have glands all over our body that produce hormones, and the hormones are the communication system. So we have our hypothalamus in our brain that governs our pituitary gland, which is also in our brain. And that gland governs our thyroid gland, our adrenal glands, which are our stress glands, our reproductive organs and glands, and they do it by way of hormones, by creating chemicals that travel through our bloodstream, go to another site, and provide information. So they're commanders, they're communicators. Hormones affect how your brain works. And I have to say, when I first got into the field of longevity medicine, I mainly knew about hormones and reproduction. And so I knew about menstrual periods and having babies and menopause symptoms, but I didn't know about all the other things that hormones do and how important they are overall. They regulate our stress, they regulate how quickly we age, they regulate our immunity, they regulate our metabolism, how quickly our engine burns food and calories. And of course, they do control reproduction as well. And these are the hormones that we work with at the Sklar Center. Estrogen, progesterone, testosterone. These are hormones that are in women as well as men. We think of estrogen as being mostly a woman's hormone and testosterone as being mostly a men's hormones. But in fact, women have small amounts of testosterone and men have small amounts of estrogen. And in fact, we think that the estrogen that men make from their testosterone is part of what keeps men's brains healthier and cuts down the risk of Alzheimer's. We work with DHEA, dehydroepiandrosterone, which is really important: vitality, immunity, blood sugar regulator, energy producing hormone. We work with pregnenolone, which is a fabulous anti-inflammatory hormone. Pregnenolone used to be used to treat rheumatoid arthritis. And one thing I want you to know about hormones is that hormones, which are natural products, can't be patented. So you couldn't patent pregnenolone and make a ton of money on it, because anybody could make pregnenolone and distribute it. And pregnenolone in the 40s was used to treat rheumatoid arthritis because it was such an incredible anti-inflammatory agent before the days of prednisone. And prednisone is a synthetic cortisone type anti-inflammatory that could be patented. So drug companies made a ton of money off of prednisone, along with a number of other things. But we still use pregnenolone. Pregnenolone acts as a neurotransmitter, a chemical transmitter in the brain, and helps us lay down new memories. Pregnenolone helps to reduce stress when we get stress on our adrenal glands. Pregnenolone, like I said, is an anti-inflammatory that can help joint inflammation and autoimmunity. Cortisol is our main stress hormone when we are in a life-threatening situation, which we think we are all the time, all day, every day in modern society. It might just be sitting in traffic, or it might be your boss yells at you, or it might be a disagreement with your partner, but your body thinks you're in a life-threatening situation and releases cortisol and creates a whole cascade of things, which if you really were in a life-threatening situation would definitely help you save your life. But since most of the time we're not, that cortisol release ends up on a day in and day out basis being harmful to our bodies. Thyroid is like the thermostat. It governs how fast or how slow our metabolism goes. Melatonin, you know, in terms of sleep, melatonin is an important regulator of the day-night cycle. And human growth hormone, which we'll get into a little bit later. We don't generally prescribe human growth hormone, but we have ways of stimulating it. Lots of things stimulate human growth hormone, and people worry about growth hormone. They know athletes use growth hormone or try to use growth hormone. Growth hormone has been associated in people's minds with growth of cancer. And in fact, if you can just think of human growth hormone, if it had the name human healing hormone, that's how you should think about it. So it gets released when we're in deep sleep during the night. And that's why one of the reasons sleep is so important. And it heals your body from the multitude of assaults that have gone on during the day. So it's really a healing hormone. It does not make things grow. So women have a number of different hormonal changes in life. So we have menarche. That's the medical name for puberty, or when you get your first period. Then we have menstrual periods, which we all know women cycle up and down, up and down, up and down. We sometimes have problems with our menstrual cycles, like premenstrual syndrome or PMS. We have pregnancy, which causes huge hormone changes. We have the perimenopause, another time of tremendous hormone change. And then we have menopause, which means a year with no menstrual period. That's the official definition. When you have gone a year without a period, you are considered to be in menopause. And some people use the term postmenopausal. I think once your period's been gone for a year, you know, the main thing is that you are not going to make some of those hormones again. And if you're having problems, restoring them can make you feel a lot better. So whether you call it menopause or postmenopause, I think is really a matter of semantics, not really medically essential to know about. We have stress-related changes. When we get really stressed and make a lot of cortisol, our other hormones suffer. And I'll show you a graph and chart how that works. And then we have age-related changes. So there are a number of hormones that simply go down, 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 starting at about age 25 or 30, and continue to go down our entire lives and really have impact on our energy, our vitality, and our sleep. So I got a picture of a roller coaster because women are really on a hormone roller coaster. We are for a lot of our lives. And I'm not saying men don't have changes in their hormone levels, but women have a lot of ups and downs. And it starts with starting to have menstrual cycles. So that's part of the ups and downs, are the natural process our body goes through each month in getting ready to have a pregnancy if that were to happen. That's what menstrual cycles are about. They are about getting ready to get pregnant. Hormones, as I said, are affected by age, by stress, which I mentioned, by environmental toxins. We'll talk about that a bit at the end. And I'm going to give Dr. Nicole Dodona a plug because she's going to be doing this talk next month on toxins, environmental toxins, and the effect that they have on us and what we can do about it. Sleep has an effect on your hormones. As I just mentioned, human growth hormone gets released during deep sleep. Deep sleep, it happens in the first part of the night between about 11 and 3 a.m. That's when you're in the most deep sleep. If you cut yourself short, you go to sleep at 1 in the morning, you're losing out on deep sleep and you're losing out on the release of growth hormone. Your nutrition plays a role. Eating a high carbohydrate, refined carb, high sugar diet keeps your body from making adequate amounts of important hormones. And exercise affects hormones as well. Doing resistance exercise, especially for men, increases your testosterone level. So we definitely can see a direct effect between our activity and our hormone levels. This is a picture of what happens through a woman's life cycle. And you can see at a young age, hormone levels are very low. And then starting with the onset of menstrual periods, we start to get this up and down in estrogen. We get some ups and downs in progesterone. In the perimenopause, things get very erratic. And at menopause, those hormones are gone. They've gone away. And the question of when it starts. So this is a very interesting graph. The age at menarche, which, like I said, is the time when the first menstrual period occurs, has been getting lower and lower as the decades proceed. And it's different in the US than it is in other countries. So here's the United States, is the brown line up here. Back in 1850, the average age of a first menstrual period was age 17. Now in the United States, it's down here at 13 and a half. If you look at, I think that was Norway. The United States, okay, here in 1910, average age was 14. Now the average age in 1990 was 11 years old. So why is this happening? We think it's happening because of environmental toxins. There are a lot of toxins that fool our bodies into thinking hormones are there. They're called endocrine disrupting chemicals, or EDCs. Our bodies think we have lots and lots of estrogen and start going through those hormone changes that we would have if our estrogen levels started increasing. And we don't really have our own estrogen, but it gets this puberty started, this first menstrual period started at much younger ages. And the effect it has on men is not good. It reduces sperm counts. So these endocrine disrupting chemicals reduce reduced sperm counts, and I don't have a picture or a graph for you, but sperm counts have been going down, down, down over the decades. And then what happens when we have a menstrual cycle? So I'm going to go through this graph with you. If you start over here on the left, this is when you're actually having a menstrual period and bleeding. Well, your hormone levels are all pretty low. Then estrogen levels start going up. This is the orange line. You ovulate or release an egg, which is getting ready to meet a sperm to have a pregnancy. Estrogen levels come down at ovulation and then come back up after ovulation. Progesterone is low, 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 low until after ovulation, and the place in your ovary where the egg has left from is where the progesterone gets produced. And it's called the luteal part of the follicle, a luteinized follicle. A follicle is a little spot where the egg left from. So your estrogen goes up and down and up, and then if you don't get pregnant, your progesterone and your estrogen both come down and you get another menstrual period. If you get pregnant while you're ovulating here and a sperm meets your egg, your progesterone goes up and continues to go up, up, up to support the pregnancy. And the same thing with your estrogen. It will go up, up, up to help support a pregnancy. This is another way of looking at the menstrual cycle. It shows you what's happening. Here is the menstrual period. This is the lining of the uterus. It's falling out, creating bleeding. That stops. Your estrogen level starts going up and you start developing a thicker lining in the uterus. Then progesterone comes along and the lining gets even thicker. And this lining is getting thick in anticipation of a fertilized egg implanting and needing all kinds of good blood vessels with lots of nutrients. And what's happening up at the top is what's going on with your ovary. So there's a little spot in the ovary where this egg is and being nourished by the fluid around it. And every month, one of these follicles becomes a dominant one and starts to go through these changes where it enlarges. Eventually, an egg gets released, goes into the fallopian tube. If there's sperm there, it'll meet the sperm and, and greet each other and start a fetus going, and that will end up coming down back into the uterus, into this lush lining to implant. So that's what happens during the menstrual cycle. This corpus luteum is where progesterone gets produced. So it gets produced by the spot in the ovary where the egg left from. After the corpus luteum is done, if we are not pregnant, it turns into kind of a scarred area called a corpus albicans. And what happens with all of this up and down and up and down? Well, women respond to hormone changes. And one of the things that can happen is premenstrual syndrome. Nobody's exactly sure why it happens, but it's something to do with those estrogen, progesterone, and possibly serotonin, which is a brain chemical, a neurotransmitter that is supported by estrogen. And so there may be serotonin changes too. PMS can consist of physical symptoms like breast pain, headaches, bloating, and emotional symptoms like anxiety, stress, or anger. Things that contribute to PMS, the things I've mentioned already, sugar and high refined carb diet, caffeine, alcohol, stress, and lack of exercise. And dairy consumption, if you are drinking conventional milk, because of the amount of hormones that are used to raise the cows, they get into the milk and can make PMS worse. And then what happens during pregnancy? So I mentioned to you, if you get pregnant, instead of the progesterone and the estrogen levels falling and getting a menstrual period, those levels go up, up, up. And you can see on this chart, ovulation happened here. The progesterone level goes up, 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 up. The estrogen level goes up, up, up. And human chorionic gonadotropin, which is the hormone that we measure when we do a pregnancy test, goes up shortly after pregnancy at about 2 to 4 weeks. So women, we have this tremendous change in our hormone levels. Our progesterone level is 20 times higher than when we're not pregnant. And progesterone does a lot of really wonderful things. It creates a sense of calm, it helps mental focus, but it also relaxes muscle. So women sometimes have heartburn during pregnancy, even before their belly is so big, like this woman's belly pushing her stomach up. Progesterone relaxes what's called the lower esophageal sphincter. That is the muscle that holds our esophagus tight and keeps stomach acid from refluxing back up into the esophagus and giving us heartburn. And progesterone relaxes that muscle. And so women get more heartburn during pregnancy because of this very high progesterone. The estrogen is actually 200 to 300 times higher than in the non-pregnant state. And it's responsible for the changes in breast, the growth of the uterus, and a lot of things that go on to support the pregnancy. And as I said, these hormones promote this relaxation and feel-good response. And then we have our sweet little baby. And then what happens is, remember I told you that progesterone and estrogen go up, 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 and they're nice and high, and then we have the baby, and boom, both of those are down to rock bottom and stay rock bottom the whole time that women breastfeed. And that is a huge amount of hormonal change. The hormone levels, the estrogen is so low that some nursing women have vaginal thinning and painful sex, just like menopausal women do, because they don't have any estrogen on board. They don't have progesterone on board. And if you're nursing primarily and the baby is not taking a bottle with other things, you are very much suppressing your hormones for as long as you're nursing. After a while, either with weaning the baby, spacing out nursing, menstrual periods come back and hormone levels resume their up and down pattern. One of the things that happens postpartum to some women, as many as 1 in 7 mothers, is postpartum depression. It's possibly due to these very rapid hormone changes. It also may be due to other things. Sometimes thyroid glands majorly malfunction with delivery and the changes that go on and can contribute to postpartum depression. There are nutritional deficiencies that might be the result of the pregnancy. Those important omega-3s that we want to have in abundance to help the baby's brain develop as well as possible may in fact end up sapping our own omega-3 stores. And low vitamin D and low iron may contribute to postpartum depression. But certainly that tremendous decline in hormones very suddenly is a major contributor. And then we go back to having our menstrual periods, with the up and down, up and down, up and down every month until we get to perimenopause. And then those up and downs become quite unpredictable and erratic. So one of the things that I tell women you can be absolutely count on in perimenopause is that you can't count on anything happening with any regularity. So menstrual periods may be spaced out further than usual. They may be closer than usual. They may be longer. They may be shorter. They may be lighter. They may be heavier. But what we do know is that they are going to change because hormones are really erratic. And then once we get into menopause, here are changes. So estrogen declines 35% between age 35 and 50, and progesterone declines even more. And the reason that they use the ages 35 to 50 is in fact perimenopause starts at age 35. And I know people especially in the medical profession, I've had a lot of patients tell me in their late 30s and they feel like they're going through some hormone changes. They don't feel like their old selves. And they get told, nah, that couldn't possibly be perimenopause. You're way too young. Well, in fact, perimenopause starts at age 35. And age 50 to 51 is the average age of menopause. It can be anywhere from age 45 to 55 and still be considered normal. Menopause before age 40 is called premature menopause, and it's felt to put women at increased risk of a variety of things because of losing that hormonal support so early in life. So estrogen has a lot of protective effects on our blood vessels, on our brains, and we lose that when we go through menopause and lose those hormones. These are probably the most common symptoms that I hear about in perimenopausal women, and it were the symptoms that the first patient with burning mouth told me about. Fatigue, weight gain. Even if you don't gain weight, you may have shape shifting where your waist and belly that were nice and small and flat now get larger, and you have fat deposits around your midsection, even if you don't actually change your weight. Hot flashes occur for a lot of women, and we think hot flashes are actually a sign of brain inflammation in the temperature regulating center of the brain. With hot flashes comes insomnia. With lack of progesterone comes insomnia, anxiety. With lack of estrogen comes more depression. Remember, I said that estrogen supports serotonin, which is the feel-good brain chemical that we think keeps us from feeling depressed. And if estrogen levels are low, serotonin is not well supported, and we can end up with depression. Forgetfulness, estrogen's really important for our memory. And it turns out that women who have a hysterectomy before menopause age and get their ovaries removed so that they are premenopausal before age 50 and have a sudden loss of hormones actually have a 15% reduction in brain speed. So their thinking processes are 15% slower because of losing their estrogen. The other thing that we see is decrease in libido because testosterone levels go down. And then what happens to men? So we've spent a lot of time talking about women. Men go through changes too, but they're more gradual. They're not as dramatic as having menstrual periods and then boom, having them go away. And the medical name for changes that happen to men with their testosterone hormones and other testosterone-related hormones is called andropause. Testosterone and DHEA and their related metabolites are called androgens. That's the class of hormones they fall in. And so when androgens decrease, the medical name is andropause. And we in anti-aging and longevity medicine kind of jokingly call it menopause to go along with women's menopause. And the risks that happen with loss of testosterone are premature aging. Testosterone is important for maintenance of muscle in women as well as men. So with loss of testosterone, we lose muscle mass. We can end up with higher body fat, that part of the shape shifting I'm telling you about. Even if you don't gain weight, you may have less muscle and more body fat. And muscle is extremely important for healthy longevity. Higher inflammation. Men get bone thinning and osteoporosis too when they lose their testosterone hormone. Women lose it when we lose our estrogen and progesterone and testosterone. There is higher mortality from heart disease. And I know people have told you using testosterone supplementation gives you cardiovascular disease, but in fact, the statistics don't really show that. And men with low testosterone are at increased risk of Alzheimer's and other forms of dementia. And like I explained, we're hormonally at our optimal at about age 25 to 30, and then a number of hormones start declining, and testosterone is one of them. And in men, it declines by anywhere from 1% to 3% every year. So by the time a man is age 60, he has lost, a good 40 to 60% of his testosterone. And even age later than 60, it declines further. Here's a graph that shows you testosterone decline with age. And you can see what happens by the time men are in their 50s, 60s, and 70s. And what happens when testosterone levels decline? A number of things can happen. One of the things we call this emotional changes that go on. It's a non-medical longevity medicine term, the grumpy old man syndrome. And I put a picture of Felix and Oscar on here because they were the odd couple and they were pretty grumpy, especially Oscar. But men go through similar changes when they have hormone decline in their testosterone, less energy, decreased sex drive, not sleeping as well, thinking not as clear, loss of exercise endurance and muscle strength, emotional swings, and irritability. So these are some of the things that can happen when men lose testosterone. Like I said, 25 to 30, our hormones are optimal levels. And here are some of the other ones that decline with age. So I explained to you that DHEA, dehydroepiandrosterone, is a really important energy and vitality hormone, also important for immunity. And you can see how it's peaking here at about age 25 to 30, both in men and women. And by the time we're 70, 80, 90, there's hardly any left. And it accounts for some of what we think of as, quote, normal aging changes are in fact hormone decline, which means we can do something about it. Other things that decline with age, melatonin. So our sleep is not as good as we age because we don't have as much melatonin. And it's one of the reasons why it's so important to turn off your screens at night because they suppress melatonin, keep the lighting low, wear blue blocking glasses. All of those things help to keep your melatonin going at good levels and prevent suppression of it. Blue light suppresses melatonin. But you can see what happens through the lifespan with melatonin. The other one is human growth hormone that I mentioned before. And you can see here that it's at its optimal, its highest at about age 20, and then it declines and goes down, down, down in our 50s, 60s, 70s, and 80s. Growth hormone is our healing hormone. It heals our injuries. It heals our bodies. It heals our brain. It heals our memory. And when levels go down, we lose vitality. We lose mental sharpness. And then stress affects your hormones. So this is, my husband and I were in Monument Valley and we were touring around and saw this little cabin and it had this sign on it. It says stress reduction, bang head here. So directions are place on a firm surface, follow the directions in the circle and repeat that until as necessary or until unconscious. And I know sometimes we feel like we do want to bang our heads against a wall because stress builds up and we don't know what to do with it. So here is the steroid hormone pathway. So I know this is very medical, but what I want to show you is, first of all, that cholesterol is not our enemy because all of our hormones are made from cholesterol. And I know doctors want to lower cholesterol levels to cut down risk of heart disease, but there are probably limits in how low it should go. And especially if you're having cognition problems, you would really not like to have your cholesterol below 160. And that's something that needs to be talked individually with your doctor because if you have serious vascular disease, you have vascular disease in the blood vessels in your brain, that can affect your cognition also. But our hormones start getting made with cholesterol, which is circled in red. And the next step is in the metabolism is pregnenolone, which we've already talked about. And from pregnenolone, we make progesterone. And from pregnenolone and progesterone, it can go over to the right side and end up making what we call our feel-good hormones, DHEA, testosterone, and estradiol, which is estrogen. If we are stressed, the pathway goes from pregnenolone straight down to cortisol, because if your body thinks you're in mortal danger, it makes cortisol in preference to anything else. And you will lose your feel-good hormones in the effort to raise cortisol. Most of us are not in life-threatening situations. We are not in mortal danger all day, every day, but our bodies think we are. So it becomes really important to do things that tell our body that we're not in mortal danger. And those we'll go over later. Stress reduction techniques. I mentioned toxins, endocrine disrupting chemicals, things that are in health and beauty aids. We need to be really careful about what we're putting on our skin, because our skin is a huge area that we absorb things into our bloodstream. There's no barrier there. You put it on your skin, it gets absorbed into your bloodstream. So health and beauty aids that have parabens in them disrupt our healthy endocrine function. These things act like estrogen, but not a good kind of estrogen. And they fool our bodies, and they create what we call estrogen dominant states, things that cause endometriosis, fibroids, heavy periods, painful periods. And they're found all over our environment. We take them in every day when we eat, unless you really focus on getting organic foods. Like I said, they're in our health and beauty aids, or in our cleaning products. And not only are they endocrine disruptors, a lot of them are carcinogenic. Huge amounts of pesticides are sprayed on our fields, and the average American unknowingly eats about 124 pounds of additives a year. They may not all be pesticides. There are plenty of additives that are put in foods that are not pesticides, but these things all disrupt the healthy function of our system. So what is the solution? We have a solution. We work on a variety of things. So one is using hormone therapy with bioidentical hormones to fill in the hormone gaps. And so what do I mean by bioidentical hormones? I have to say, before I got into longevity medicine, I heard the term bioidentical hormones and I would roll my eyes. And I thought, that's just like that's just a marketing term somebody's using. That's ridiculous. And I don't know who these people are, like Suzanne Summers and all of that. Well, it turns out bioidentical hormones mean that the hormones are chemically exactly the same as what our bodies make. And we are able to make those in the lab, usually from yam or some other precursor sort of hormone type structure that then gets made into bioidentical hormones like estrogen and testosterone and progesterone. They function in a much healthier way than the synthetic hormones that are out on the market. When I say fill in the hormone gaps, what we find is in perimenopause, when progesterone levels are down and then they're up, estrogen levels are down and then they're up. If we can fill in where they drop and women start getting symptomatic with hot flashes, like a lot of women will get hot flashes the week before their period during perimenopause. So using some estrogen during that time to help with that tremendous drop in estrogen before menstrual periods come on. We use peptides to help raise growth hormone, and we've had great responses with people feeling like they were 20 years younger, with their endurance and resilience improved, with their sleep better, their memories better. So peptides do a really good job of raising growth hormone in a very natural way, letting your body do it rather than imposing a growth hormone, actual hormone into your body. Lifestyle changes are really important. I talked to you about why sleep is so important, why stress reduction is important, and why toxins avoidance is important. So having healthy hormones is not just using a hormone and putting a cream or a gel on your skin. It's doing these other things also. So I want to talk some about myth versus truth, and I have some solution sheets that were too much to put into this talk. And so for people who are interested, we'll give you a number that you can text us. And if you're interested in getting a copy of the slideshow and would like to get information on solutions for premenstrual tension and postpartum depression and perimenopause, we have some information sheets for you that we can send you. A little bonus. So the real question is, are hormones bad for you? That's always the issue, right? I wouldn't be doing this, and I've been on hormones myself for 25 years. Trust me, I wouldn't be on them if I thought they were bad for me. A lot of women, when I talk to them, if they're reluctant to be on hormones, finding out what hormones do for our brains is a big motivator to being on hormones. And this was a huge study. It was a meta-analysis, which is a scientific study that looks at many, many different scientific studies and pulls all of the information together. And it said that women who were symptomatic from menopause, so it meant women who were having some hot flashes or mood changes, some outward signs that they were lacking in hormones. If they were put on hormones, they had improvements in verbal memory, which means what you're hearing people say or what you're reading, reasoning, and motor speed. If women were asymptomatic, they weren't having hot flashes, they didn't see these benefits. So that's interesting. Something about having menopause symptoms are an indicator of hormone lack, perhaps maybe more than women who had no symptoms. This is a huge study that came out fairly recently. It was 379,352 women from Humana, the Humana health system. And they looked through the records to see who was diagnosed with neurodegenerative diseases. And they looked at Alzheimer's, they looked at amyotrophic lateral sclerosis, which is a progressive paralyzing neurodegenerative disease, also known as Lou Gehrig's disease, because Lou Gehrig developed it. They looked at multiple sclerosis, which is a neurodegenerative disease, and Parkinson's. And what they found was that women who were on hormones had 58% reduced risk of getting neurodegenerative diseases, which is huge. And then what about heart disease? So the American College of Cardiology came out with a statement. A lot of doctors, and I'll tell you why in a minute, think that hormones cause heart attacks and strokes. If they're given properly, if they're given in the right form, if they're given the proper route of administration, do not do that. And so this was a study looking at women on hormone replacement therapy to relieve symptoms of menopause. They were 30% less likely to die if they were on hormone therapy, and they had less atherosclerosis or plaque in their arteries compared to women not using hormone therapy. So they had a group of women that were on hormones and an age-matched group of women not on any hormones. And the hormone group, 30% less likely to die. And then talking about benefits for men, because we've gone over benefits of hormones for women, increased libido, increased energy, bone density improvements, increased muscle strength and endurance, and cardioprotective or prevention of heart disease in men. And these are hormone benefits for women: improved energy, improved stress resilience. We talked about that with DHEA, less depression and anxiety, clearer thinking, improved memory, better mental focus, improved sleep, and increased in libido and sexual satisfaction. We see that every day in our practice with women who go on hormones who've had problems with these things. So the real issue, of course, is, aren't hormones dangerous? So the Women's Health Initiative, and this has been a huge tug of war about whether hormones are beneficial or dangerous. The Women's Health Initiative came out in 2002. It's been almost 20 years. And the Women's Health Initiative was run by the National Institutes of Health in conjunction with Wyeth, who makes Premarin, which is a form of hormone replacement therapy. And they had 80,000 women, so it was a good number of women. And they had women on Premarin as their hormone replacement, and Provera as that was their estrogen hormone replacement, and Provera, which is a synthetic progesterone, for their progesterone replacement. They waited to give women any hormones until women were average age mid to late 60s. So what happens to women is we have a protective effect from estrogen until we hit menopause at age 50. And then if we're not on hormones, we lose that protection. If you wait 15 to 17 years to first start a woman on hormones, which is what happened in this study, women were 65, 67 years old on the average, they already have some plaque laid down. They already have some cardiovascular disease roughness in their blood vessels. And you're giving them Premarin in a pill form. Pill forms of estrogen induce clotting factors, goes down through your mouth, into your stomach, into your intestine, through the liver, what we call a first pass through the liver, where it induces clotting factors and thickens your blood. So you've gotten older women with plaque who now have thickened blood, and they were more likely to get blood clots that caused heart attacks and strokes. So the result of the Women's Health Initiative is, yes, there was an increase in heart attacks and strokes. They used the wrong group of women. They waited until women had had no estrogen treatment for 15, 17 years. They used the wrong route of administration. If you use estrogen in a skin patch, a skin gel, a skin cream, or a vaginal ring where you don't eat it and have it go through your liver, you do not get those clotting factors. And then they use the wrong progesterone. They use Provera, which is not natural progesterone. It's not bioidentical. And guess what? It caused an increased risk of breast cancer. So this is Premarin, and Premarin got its name. It's a shortened form of pregnant mare's urine. And that's where Premarin comes from, pregnant mares. They have these horses in stalls, and they're collecting their urine, these pregnant horses, and then they extract hormones and put them in a pill and give them to you. Estradiol is our bioidentical estrogen. It is what's made for our bodies, and it's protective and brain enhancing. And like I said, if given in a transdermal or skin form, I told you things get absorbed through your skin. Estrogen gets absorbed through your skin. You do not have the clotting risk. So here's the comparison. Bioidentical estrogen given topically, no increased risk of clotting. Premarin, increased risk of clotting. Bioidentical estrogen protects against heart attack. Premarin, increased heart attacks in older women. Bioidentical estrogen protects against stroke. Premarin, increased strokes in older women. Bioidentical estrogen protects against Alzheimer's. The Women's Health Initiative noted an increased risk of dementia in women who were on hormones. It was not Alzheimer's disease. It was dementia due to mini strokes. So in fact, even Premarin helps prevent Alzheimer's, but the problem is in the mini strokes that cause what we call vascular dementia. And we also often use estriol, is another type of bioidentical estrogen that actually can be protective for breast cancer. The interesting thing was Premarin by itself did not cause an increased rate of breast cancer. So they had a group of women on hormones, Premarin and Provera. They had a group of women on no hormones at all. And they had a third group of women who had had a hysterectomy, and they only had them on Premarin. And not only did that group that was only on Premarin not have an increase in breast cancer, they actually had a decrease in breast cancer, even though they were on Premarin. And then the problem with the Women's Health Initiative was the Provera, which is the synthetic progesterone that actually has a number of anti-progesterone effects. It prevents uterine cancer, cancer of the uterine lining, but it increases breast cancer risk, and it increases it substantially by 30%. So the Women's Health Initiative came out in 2002. The headlines were all over that hormones were bad for women. Women went off of hormones wholesale. We did not have a really good analysis of what happened, and all of the details did not come out for years later. It was stopped because they saw an increased risk of breast cancer. The study was stopped. Women went off their hormones wholesale. And it was later that they found, oh yeah, the people that were only on Premarin, they actually had less breast cancer. Oh yeah, it was the Provera that gave them breast cancer. So then stop using Provera. And I think Provera should be off the market. It's still on the market. It's still available. Here's bioidentical progesterone. And here are the comparisons of natural progesterone versus the synthetic progestin called Provera, which stimulates breast cell growth, increases heart attacks and stroke, doubles insulin resistance, and instead of being a natural calming agent, which we see all the time with natural progesterone, has emotional irritability as a side effect. The interesting things, and what I came across in doing research on hormones and cognition, is that in animal studies, estrogen almost all the time showed enhanced learning and memory in rat studies. So they take rats, they take out their ovaries, they have a group they give estrogen to, they have another group that they don't give estrogen to, and they see how well they can learn things. And so rats learn to run through mazes and do other tasks, and you can judge their learning and memory. And animal studies mostly show, animal studies all show benefits from estrogen because they are always giving the animals estradiol, which is the bioidentical form of estrogen. The human studies of estrogen mostly show benefits, but some don't because Premarin is used. So it's interesting, my takeaway from it was that rats get better treatment than women, but I'm sure there are other takeaways too. And then there's the issue for men, what about testosterone? And the two things that always come up are the question of prostate cancer and the question of cardiovascular risk. So when they've looked at men's testosterone levels and incidence of prostate cancer, there is no relationship between the testosterone level and prostate cancer incidence. So they don't have a group of men, with low testosterone and they have low prostate cancer incidence. And then as the testosterone levels go up, they show more and more prostate cancer. There is no connection between testosterone levels and prostate cancer. And when they've done studies on using testosterone and prostate cancer incidence, there is no increased risk of prostate cancer. So the whole issue of prostate cancer growing because of testosterone use came from a case report from the 1940s of a few men that were studied who were on testosterone and got prostate cancer. And that has permeated our entire medical profession without regard to studies that show the contrary. And even in men who have prostate cancer, if they're given testosterone, their cancer risk is not increased. And the same issue actually comes up for women and breast cancer. If you give breast cancer survivors estrogen, they actually have a reduced recurrence rate and an improved mortality. And the benefits of testosterone, we've gone over, improved sex drive and energy levels, bone density, not losing bone as much, improved endurance and strength, and protective effects on the heart. And the newest thing that we've been doing is using peptides, and there are growth hormone releasing peptides and growth hormone releasing hormones. And what these do is when you use them, it doesn't push your body to make extra growth hormone, but it removes some of the blocks that our own bodies have to making growth hormone. We have some chemicals that prevent growth hormone release, and these peptides remove the block. So we're not forcing our bodies to make a huge amount of growth hormone. We're not giving our bodies huge amount of growth hormone. We're allowing our bodies to make what they need. And we pretty reliably see an improvement in the quality of sleep, people recovering from injuries more quickly, better exercise recovery and endurance, memory better, and improved body composition with more muscle and less fat. I talked about stress reduction being very important for improving your hormone situation. Yoga and meditation decrease the cortisol level, so allow your body to make less cortisol and more of those feel-good hormones, estrogen, testosterone, and progesterone. Yoga and meditation and reducing cortisol actually improves your immune function, your memory, your sleep, lowers stress, lowers inflammation, increases your antioxidants, and increases something called BDNF, brain-derived neurotrophic factor, which is like miracle grow for your brain. So anything that you can do to bring down your stress levels will lower your cortisol levels and allow these physiologic natural processes to proceed that are good for your health. The other thing you want to do is clear out your home of cosmetics that have parabens, household products that have, excuse me, a whole variety of chemicals that are bad for you. Pledge is not great. Mr. Muscle, there are lots of low toxicity house cleaning products. There is vinegar and water, that is a great cleaning solution. There are other natural homemade cleaning products you can use. And very importantly, to be sure that you're eating foods that are pesticide-free, meats that are hormone-free, chicken that's hormone-free, and fish that's wild caught. Other ways that we get toxins are with our Teflon-coated pots and pans. Storing things in plastic that contain bisphenol A or BPA. Keeping our water in water bottles and then leaving the bottle in the car where it heats up and the bisphenol A from the plastic leaches into the water. Using any purchased water that is contained in plastic because it sat in a truck somewhere in hot weather and the BPA is leached into the water. So having a home filter and using a metal or plastic water bottle or a BPA-free water bottle is really the way to go. There are detox things that you can do for your body, and this is one of our favorites. This is Core Restore from Orthomolecular, and people I've had that use this, it's a 5-day program with different components, almost universally find that they feel better. They either sleep better or they lose some weight or their energy is better as they are mobilizing and getting toxins out of their bodies. So I hope I've given you some good ideas on how to live long and healthy. I appreciate all of you attending. We've had a great turnout. The next month, we are going to be going more in depth on toxins with our wonderful Dr. Nicole Dodona, one of our naturopathic doctors. It will be on Zoom at the same time on Tuesday, October 26th. And the last thing I'm going to leave up is our text request slide. If you text this number, you can let us know if you would like to have a consultation. You can text us and say slides or info, and we'll send you a copy of the slideshow and the information, the add-on information that I mentioned. Include your name, your phone number, and your email address. The email is really the only way that we can send you the bonus items and the slideshow. And with that, I'm happy to take questions. I don't know if there are any in the chat. Oh, it looks like there's some in the chat. let's see, if you're 68, you've never used hormone replacement, does that mean you shouldn't start now? So no, I don't think it means you shouldn't start. What I think is that you need to be on the right hormones. You need to be on ones that are not going to increase blood clots. So that means using estrogen preparations that go through your skin and using bioidentical progesterone. And it also depends on why you want to use it, because if you have a compelling reason, cognition, energy, mood, I think that the benefits really far outweigh any risk, which really there are not increased risk if you use estrogen in a patch, cream, or a gel on your skin. Just don't use it orally. Don't take it in a pill. Any insights on birth control? So birth control pills are super high dose synthetic estrogens and progesterone, and they really tamp down your own body's production of hormones. For contraception, they can't be beat. They have a really good effectiveness rate. The problem is that they're used to treat a lot of medical conditions and hormone imbalances in women that can be treated other ways. So if a woman does not need birth control pills for contraception, but is using them because of painful periods, heavy bleeding, endometriosis, and fibroids, we really want to get at the root of why those conditions are happening, which is usually too much estrogen, not enough progesterone. It might be too much of your own natural estrogen, or you may be in contact with endocrine disrupting chemicals and toxins in your environment, which have definitely been related to endometriosis. How do you know which hormones you need and how much you should take? It really depends on what your blood levels are, what your goals are, and it's really a process of starting at a fairly low level to try to get as much benefit without having side effects. And the side effects are annoying, not serious. So you don't want to load a woman up who hasn't been on hormones 10 years post-menopause on a huge amount of estrogen, because her body hasn't seen it for a while, and she's more likely to have breast soreness and swelling. And so why do that when you can start on a lower dose and kind of see how it goes and ease somebody's body into it? And so we go by what blood levels are like, and we try to optimize blood levels back to what would have been there, at what you would have been at age 25 or 30. And we go by your symptoms. So if you're feeling pretty good and your hot flashes are gone, we don't necessarily need to raise your estrogen to particularly high levels. If your cognition's an issue, we definitely want your estrogen at higher levels. So it depends on your reason for being on hormones, what your starting levels are, and sometimes other things that are going on in your health history will make a difference. So those are the ways we take your health history into account, your blood levels into account, and your symptoms into account. Let's see, are we having any? Is blood or saliva better to determine hormone needs? So there's a raging debate, and I spent a lot of time going to lectures when I first 14 years got into this whole field of longevity medicine, the raging debate about saliva, blood, or urine. So they're all different ways to test. And what I found out is they each have their advantages and disadvantages. And the main thing is for the practitioner to get knowledgeable and expert in how whatever the method is that we're using to determine levels correlates with the amount of hormone you're giving and the results you see in your patients. So there really is not one right or wrong. I'm accustomed to looking at blood levels and I know what to expect with them. Some doctors use saliva. And so it really depends on your practitioner, what they're experienced and comfortable with. How do I feel about metformin? So metformin is a insulin resistance lowering medication that's used a lot for pre-diabetics and diabetics. There is some use for it in the longevity world. But I heard a really actually knowledgeable talk about metformin, and it seems like you can't just get the longevity effects of it without some downsides. So it seems like in some ways it helps longevity. I can't remember all the details. And in some ways it actually does not help longevity. So I at one point thought it would be a wonderful thing to put everybody on, including myself. And when I looked into it more, I decided maybe not. And let's see, somebody who's a female, 55 years old, has been on a couple of bioidenticals for a few years with hesitation because your mom had cancer at 42 and from Premarin, and thanking me. So, you know, a lot of women got breast cancer and were on Premarin. Did the Premarin cause it? It's really hard to know that. People sometimes mistake, you know, when women do develop breast cancer, there are receptors that are tested for. There are estrogen receptors, progesterone receptors. And if you have breast cancer and your biopsy shows that you're estrogen receptor positive, it does not mean that estrogen caused your breast cancer. It means that an anti-estrogen chemotherapy treatment will help you not get a recurrence. So it guides treatment for breast cancer. It does not mean that estrogen caused breast cancer. And there, in fact, are so many things that go on that cause breast cancer. There's certainly genetics. So for somebody like you who's 55 and your mother had breast cancer at 42, that's young to have breast cancer. You might want to see if you have the genetics, the BRCA gene, the BRCA gene. That would be one reason to think maybe twice about being on hormones, but at least you'd have the knowledge and could decide. The reasons why women get breast cancer: stress, working the night shift. In Denmark, when women who work the night shift get breast cancer, it's considered a work-related disability, and they get paid as a work-related disability because working the night shift and having your circadian rhythm disrupted increases risk of breast cancer. Stress increases risk of breast cancer. Pesticide and toxin exposure increase risk of breast cancer. So there are so many things that go on that cause breast cancer. And really, prevention of breast cancer is not just a hormone issue. It's getting your body in as best shape as possible, getting adequate sleep, stress reduction, limiting toxins. Let's see, as you age, so the amount of estradiol you take go up. It seems like doctors want you to make my Vivel dot patch less rather than more. So there's this theory in the medical community that you should be on the lowest possible dose for the shortest possible time. And that's pervasive in the medical community, prescribing hormones, not us anti-aging functional medicine doctors, but conventional doctors. In fact, that is not based on any scientific study whatsoever. That's people guessing. And what we know, there was a recent study that came out, the one I told you about on the 379,000 women. In fact, the women that were older and on estrogen for longer had even more reduction in the risk of neurodegenerative disorders. So there is nothing scientific that says the least for the shortest time. And so what you're getting with people wanting to lower the dose of your Vivel patch is this, kind of unscientifically, based mantra that it should be the least for the shortest time. And you want to look at what keeps your brain healthy, what keeps your hot flashes away, what helps your sleep, what helps your mood, what helps your bones, what helps your blood vessels. And it may not be the lowest dose. Let's see, somebody wanted me to speak to burning tongue and hormone replacement. So many of you may know that I have an area of expertise in burning mouth syndrome or burning tongue syndrome. And like I said, I fell into it because of one of my very early patients who told me her burning mouth syndrome got better on hormones. And in fact, we found treating people with hormones the majority of people have significant improvements when they're on a hormone replacement program, which includes all of the hormones that I talked about. For women, estrogen and progesterone. For both women and men, testosterone, pregnenolone, DHEA, thyroid, melatonin, and vitamin D, which actually is a steroid hormone. We call it a vitamin, but its chemical structure is a steroid hormone. So I think hormone replacement has a lot of benefits for burning mouth syndrome. It doesn't for everybody, and so we're trying to figure out why some people do not improve on hormones and have other treatments that we're using for it. Let's see, I did the BRCA years ago and it was negative. And is that the same person? Yeah, so you're the same person who asked me about your mom. Well, great. Then honestly, I would use hormones and not worry about it. How long does it usually take to see relief of burning mouth symptoms when starting hormone replacement? You know, it can take, so we have some people that note changes like right away the first month, but I would say more typically it's 2 to 3 months for burning mouth syndrome. Would hormone use help burning mouth syndrome if the burning mouth syndrome is being caused by lichen planus? So lichen planus is an autoimmune disorder that causes plaques in the mouth that are very painful. Some people have burning mouth in addition to the lichen planus. So I would say if it's lichen planus alone, you need an autoimmune approach, which may not include hormones. And an autoimmune approach for us means looking at all of the things that can trigger autoimmune disorders. Number one of which is leaky gut, when your intestinal integrity is not what it should be. So we look at gut inflammation, we look at markers for leaky gut, we look at environmental toxins, we look at past history of reactivated viruses. All of these things can trigger autoimmune disorders. And that's how I would approach the lichen planus. If you have burning mouth in addition to lichen planus, so you have areas of burning where you don't have the lichen planus plaques, then hormones may help with that. Didn't need to make that go away. Let's see. What are bioidentical hormones made of? They come from, usually extracted from yams, which have a somewhat similar chemical. They have a chemical in it which has a similar structure to the steroid ring structure of bioidentical hormones. And then they are in the lab changed from that ring structure from the yam and specifically made into testosterone, progesterone, and estrogen that are then put into creams or gels or whatever. Here's somebody whose period stopped 3 years ago and seeing brain dysfunction as well as other things like overall pain and inflammation. Can starting hormones at this stage reverse brain dysfunction or other disabling symptoms? So I think hormones could make a big difference. I don't know if it can completely reverse your brain dysfunction. Sometimes brain dysfunction is comprised of more factors than hormones alone. But we know when women lose their estrogen at menopause, you enter an inflammatory state, and it can inflame your joints, your brain, many areas of your body. So using estrogen helps to reduce some of that inflammation. I can't say that it would necessarily count on completely reversing your brain dysfunction, but I've definitely seen people where their memory gets better. Just sleeping better, having progesterone that improves, that's brain calming and improves focus. All of these things help with brain dysfunctions that occur at menopause. So I'm sorry that you're having those symptoms that occurred with the menopause transition, but I think probably hormones would be really helpful for you. And let's see, someone who's been on low dose Estrada. I'm not familiar with Estrada, but I'm assuming it's an estrogen patch for 4 months, but no relief from burning mouth. Yes, I definitely would try the other hormones, progesterone, DHEA, pregnenolone. We make a supplement called Burning Mouth Advanced Support that makes a significant difference in about 25 or 30% of people who use it. It has DHEA and pregnenolone in it, along with lipoic acid, which helps some people, methylfolate, and vitamin D. So we've seen some good results in some people with our BMS advanced support. So yeah, I would add something like that or add other hormones. Let's see, do we have any other questions? Has everybody had a chance to see the text request slide? It's 562-280-2191. And what I'd like to do is stop screen sharing and let you open up your cameras, and so I can see you and say hi. So I'm going to stop screen sharing. And I know I recognize some names. I have some friends here. I know people that have messaged us through Facebook, some of our patients. I really appreciate you being here. I hope it's been worthwhile for you and allayed some of your fears about hormones and some of the unknown. Great.
Thank you. We appreciate everything you're sharing with us.
You're so welcome. It's my pleasure. I want to get this information out as much as possible. You know, they estimated, you know, I told you about the Women's Health Initiative came out in 2002, and wholesale thousands, millions of women went off their hormones. And there's a doctor, a very well-known academic gynecologist named Dr. Sorrell, and he did a study where he estimated the number of lives lost because women went off their hormones and either had fatal bone fractures or cardiovascular incidents. He estimated anywhere in the first 10 years after the Women's Health Initiative came out and so many people went off their hormones, he estimated there were excess deaths of anywhere from 19,000 to 90,000 deaths of women who had gone off hormones and lost their benefits. So if you want to know why I'm a big hormone proponent, you know, hopefully I've gotten that across to you. So I really thank you all for being here and asking your wonderful questions. And again, the phone number for the text is 562-280-2191, and send us your email if you'd like to get the slideshow and the additional bonus gifts. Give us your phone number if you would like us to call you about a consultation. We're happy to do that. And I want to thank Riley for being on with me and being so patient and consistent. And we're going to end tonight, and hopefully we'll see you next month at our Toxin Talk.
Hi, everyone. Have a lovely evening.
Bye now.